When sign-up starts on October 1, those citizens between 100 and 133% of the federal poverty level will be able to access commercial insurance and sign up on the exchange. Once Medicaid expansion goes into effect, they will be able to switch to Medicaid if they choose to do that in the first year. After that first year, they'll have to switch over. So those folks will be covered. Secondly, the $7 million number that we've heard so much about is taken or has been established by taking the full apparent cost, $2.5 billion, dividing it by 365 to get $7 million a day. Now that is assuming that the full number of people will be on the rolls on the very first day of January. That is extremely unlikely, given all the information we've given, that sign-up will be that quick. So the $7 million number is factually inaccurate. Finally, in the bill, we have requested 2 waivers from the federal government. If either of those waivers are refused by the federal government, then the entire bill dies. This period of time that we're talking about between January and the middle of March, when this would go into effect, gives the federal government time to approve both waivers so that we will know whether or not what we're doing is been approved by the federal government and we'll be able to move ahead. And if either of those waivers is refused by the federal government, then the whole program dies, and it would seem to me somewhat wise, in view of everything else, that we be cautious as we move forward with this. Our citizens will get health care. The working poor will get health care. We'll be talking about approximately 200,000 citizens who will struggle that first year, or that first 3 months, and that is not inconsequential. But if the federal government will either quickly approve our waivers or disapprove our waivers, then we will know exactly where we stand as a state and be able to move forward efficiently.